Good afternoon, everyone, and welcome to today's LinkedIn Live about the effects of giving away medication lockboxes to reduce overdoses and how effective is that. Now, I have not been able to get one of my customers on camera yet to talk about this in the works. Everybody's busy right now, gearing up for the next prevention day that's coming up later this year. And so for now, we're just going to talk about this one study about that about caregivers. And so these are folks that should know better in some sense. Their training should have involved the safe storage of medications. And we'll jump over to that real quick. Now that I'm getting a little bit better at sharing my screens. And it's this NCI. Where'd we go? Okay, so here we are. I don't like how that looks. Spotlight it. All right. Now, in this study, we see that, let me jump back to that. We'll get this all figured out one of these days. That's not the right article. Here we go. Make it a little bigger. Etc. Etc. Is this the right one? I don't think this is the right study. Do I have too many tabs? Thank you so much for your patience while I get all this worked out. That doesn't look right. Technology is fun. Okay, back to this screen, and now let's get this over into a Chrome window so it'll pull up. That's looking a little bit better there. Okay. So in this study, it's saying that caregivers are often aware about the importance of safe storage practices and medications. And this is a small study, only 50 caregivers of 112 children. 4%. So 4%, that's two people out of 50. And these are professionals that should be trained. That feels alarming to me, or maybe not alarming, just more like, hey, this is room for improvement. And, a little over a third of them said that that their main barrier for storing was that they didn't have something to store it in. So they didn't have a cabinet, a locking cabinet, or separate room or anything like that. No boxes, no bags. Again, going back to who these folks are, these are caregivers. These are folks that should have tools for engagement for dealing with this stuff. Not enough. 50% not even aware, half. So not even aware that there's an issue going on. Of course, nearly everyone said that they were given one. If given one, jump back over here. That's the importance here. Is even there at that level, they should know the importance. They're in there dealing with this stuff on a daily basis, but they still need to be given this type of stuff so that they can put it in place and use it. Looking at the health belief model, which I think I've touched on a little bit in previous streams, but that was a study done in the 70s in response to one of the influenza outbreaks. Could have been swine flu or bird flu or, whichever. But they did a study on like, okay, what is keeping people from following our guidance, from protecting themselves and those around them? And one of the top things that had like an 89% rate of impact, barriers to access. Yeah, even perceived barriers to access. Someone with the means to just go and purchase a lockbox might not see it as something that they can do. There's still that perceived barrier, like, oh, I can't go and buy one. Yeah, you can. If you've got the means, you can go buy one and just put it in place. And you can, if you've got the means, you can buy them for like your community. But for here and the now, let's jump back into the caregivers and everything. Now, most did not have that adherence, but afterwards in this follow up, the majority said that they were now locking it up and they were satisfied with the usage. Good. Let's get more of these things in the hands of caregivers, and with that knowledge of, hey, there's an opioid epidemic and overdose crisis happening, and this is a little thing that we can implement to help drive those numbers down and protect those that are around us. Digging a little bit more into this and talking to other folks that work in that realm of outreach and prevention, they've heard of this study. They get that it's a little limited, only 50 caregivers, 112 children. And this one, it doesn't delve into the breakdown of, demographics. There's ages, in here, but without like a demographic study, we okay, which areas are being affected the most, which areas really need even more help. There's caregivers all across the country working in just a variety of roles, whether it's for seniors or for youth or adults that need help. Write that down real quick. Caregiver populations. And with part of my efforts and raising awareness about this, we can definitely loop in caregivers. Anyone that's got that point of contact, those touch points in their communities, should be made aware of this. And looking at like the Healthy Start programs, those are areas that definitely need awareness and some effort being put towards getting tools into the hands of people that are going to implement it and make the best sort of efforts using these things. Now, looking a little bit more at the study and them saying like, okay, yeah, specifically their hypothesis, providing a medication lockbox, thereby removing strongly reported barrier to safe medication storage, would improve safe storage practices. It's a It's logic. It's a numbers game in many, many regards. And given where we're at, as a country, and how long this has been going on, and the historic shortage of both the outreach, awareness, education aspect, and just giving people this stuff, it compounds. It's like interest rates. And again, numbers, and we get lost in the weeds here when it comes to numbers. So let's say 140 million prescriptions, and that's what we've gotten it down to. Opioid prescriptions, 140 million a year, and if 5% of those prescriptions translate into an issue with that substance, then you're looking at 7 million plus new issues a year, every single year, over and over again. And if, oxys are one of the bigger drivers, behind that, which oxycodone, or yeah, oxycodone, not oxycontin. Or is it oxycontin? Oxytocin. Oxytocin is that happy, positive, bonding chemical in our brain. Oxycontin and oxycodone are the opioid medications. And those came out in the mid 90s. So we've got 30 years of a compounding problem. Well, if we can kind of throw a wrench in that with, at home, making sure that kids can't get into stuff, because addiction starts in the home. That's what's said over and over and over again, and I believe it. The stuff that we have in our homes gets into the hands of kids while they're developing, and they might or might not have a predisposition, just a genetic predisposition to addiction. They might be in a point in their life where getting a hold of something like that might alleviate some of their issues, their mental health issues. Not like fixing them, obviously not. You can't think that a kid getting into somebody's prescription pills actually solves anything. It's not what I'm saying. Just in that moment, that perception of that youth is, I took this stuff, I felt better. That's the drugs. They will have that belief, and they will become a pill seeker. Not everyone. Just statistically, there's a slice in there that does that. That's a thing that happens. Regardless, that exposure, that opportunity for unintentional exposure needs to get mitigated, reduced. Parents got to make a stronger effort at keeping children away from their drugs. And medication lock boxes and locking bags are just a very simple deterrent that can be put in place without any kind of stigma or judgment. We just give it to someone that has a kid in their life, or whether it's an everyday, hey, I've got a kid in my life every day, or someone comes and visit once a week or once a month, and I got to be prepared for that. Giving it to them is really the only way at a national level to gain compliance, to get buy-in. If you were to go to the millions of people who have a kid somewhere in their life, you say you need to go and buy this, you're simply not going to get the amount of people necessary involved to doing something like that. you can kind of think of this these safety devices as an inoculation against future overdoses, in a way vaccinating our homes. But again, it requires that the crowd protection. Um, my brain is failing on what it was. The when everyone is vaccinated, or nearly everyone is vaccinated against something, then the community is more resilient against any kind of outbreaks, because it can't spread as easily. And so in here, when I'm talking about safe medication storage and lockboxes sort of being a vaccine versus overdoses, there's not enough effort being made to get this into the hands of the general population, and focusing on drug users and where those folks are, and making sure that we show up correctly, saying, hey, this is something that could have a negative effect on children. Let's lock it up. Why can't we do that? At that national level, like, what would be preventing it? Stigma. I think it comes down to stigma still, and that perception of, like, saying it's okay to be a drug user, and the amount of people out there that definitely think that marijuana is a gateway drug. There are studies here and there about different things. I would say that the prescription pills that we have in our homes are more of a gateway drug than cannabis. And regardless of how you feel about all of this stuff, educating our youth about substances and healthy choices, seeking help when and where appropriate, that stuff does way more than saying, oh yeah, this one drug is like the thing that causes all the drug problems. It's asinine. It makes absolutely no sense. It's not logical. You can't just point at any one of them and say, yep, that's the problem. It's funny, I was at a gathering last week, and someone in the audience spoke up, and this was a gathering about the opioid epidemic and overdose crisis, and sort of an update, like, hey, we can be cautiously optimistic about this. So somebody spoke up, and they're like, hey, this their word was marijuana. Who even says that anymore? But saying like it's a gateway drug, and they're over there giving away a bottle of wine. It's like, well, that's another thing is, between alcohol and prescription pills in our homes, there's considerably more available there, these days, and causing these cycles of addiction. And it goes beyond just pills. I'm talking about like alcoholism as well, or smoking, vaping, tobacco, and all that. Kids see their parents using things, consuming things, and they're gonna think, oh yeah, if they can, why can't I? My parents smoked in the home growing up, and it was like this do as I say, not as I do kind of thing. And well, that's not power. That's not strong enough. If you want to be like, hey, you shouldn't smoke, well, then maybe parents need to quit. I still vape. I was able to give up smoking like 10 years ago or so, maybe a little bit more. But I still vape. That's, something that I'd like to get away from at some point. Tried quitting, and they say it gets better, it gets easier each time. I didn't find that to be true for me, but maybe it takes, that one more thing for it to eventually stick. And I haven't given quitting vaping an honest shot in a while, so maybe I can taper down my nicotine in the solution and then go no nick for a while and then stop it altogether. I quit smoking because it got so expensive, for one, and the smell was another. I was working in a small programming shop, and I was the only smoker there. There was a dude that also vaped who helped me get into vaping more, which super thankful for that. Go to SchneiderCares.com. His last name was Schneider, my last name being Snyder, and so brother from another mother kind of thing. It was fun. We had this back and forth, and it was a web kind of boutique web programming company. We always joked about creating a website called SchneiderCares.com, but I guess RemedyGuard is SnyderCares.com in some fashion. But lock boxes don't have to just be for medications. They can be for other things as well. Any kind of our substances, and you can't throw a bottle of liquor into one of these boxes up there. But there's alcohol locks. I've going back to North Carolina and what they're doing, and they're getting thousands, almost 20,000 locks to distribute to their communities. Variety of locks: fridge locks, cabinet locks, window locks, liquor locks, just locks. It's this basic deterrent that can be sourced affordably, given away en masse with the messaging to get some compliance. And that can be a dirty word for some people, compliance. Screw you, or Rage Against the Machine. F you, I won't do what you tell me or told me. There's a counterculture out there to all sorts of things, and there is a segment of the population that just because the message is coming from government or an authoritarian level, it's like, nah, screw you. I don't care if it's some life-saving advice. I'm not going to do what you tell me. And that kind of leads me into this growing conviction that we absolutely have to remove all stigma and judgment from drug users, because drug users save drug users. Plain and simple. When Narcan or naloxone gets administered, the majority of the time it's administered by someone else that does drugs or uses substances or whatever. It's people that are right there that know the dangers and can act when something goes wrong. And that is in a very acute kind of setting. There is an immediate danger to life. You must do everything you can to save that life. This other stuff it's more insidious because it's not this immediate life-threatening situation. It's just stuff sitting around. Now, when a kid gets into that stuff, that changes the situation. But before things go wrong, that's where more effort needs to get made. And why aren't we? First, barriers to perceived barriers to access, the health belief model, all that, understanding that it's an issue. And then, things like complacency and people thinking that, there's nothing wrong going on. Everything's fine because in their bubble, in the moment, it is. But I know firsthand that complacency kills. If you think that doing the same thing over and over again, day in, day out, is just cool, that, it's not always the case. Getting people to understand that there's an issue here is going to require that concerted effort from all levels. I hope that by going through and helping share that message, spread that message, we can get more folks on board. They will then go out and say, hey, look, yeah, this is just something that we need to do, like a chain letter. And if we can forward all those chain emails that we get and whatnot, I think this is something we can do. Just raise our hand, say, hey, I'm willing to do this little thing. You give me the tools, give me a little bit of education, I'll implement, I'll execute. I can protect the people around me from, accidental exposure to some substances. We can do that. So next week, or not next week, tomorrow, what's on the agenda for tomorrow? Tomorrow we're going to be talking about suicide, and what can we do to help prevent suicides and folks, intentionally ingesting anything. So tune in tomorrow for that, where we'll be talking about doing more to save lives. So thank you for tuning in, and as always, if you have any questions or you want to get involved in any of this,